necklaces, bras for the bra strap. Usually if it's just a shoulder, we'll drop the bra strap down like shoulder or clavicle. The scapula, you'd probably have to completely remove the bra, but we usually just drop that strap down for shoulder and clavicle. Quicker than having them completely change. And then of course if there's anything over like this area of the shirt, you would need to have it removed also. So we're still going to use this size. We're just going to put it in here lengthwise, and then we'll do our collimation either the lengthwise or crosswise. That way we don't have to mess with that thing. We're going to do them all standing. That's how you're going to see it in clinic. Your shoulder could be done laying down, but we never really do unless the patient can't stand. So we're going to switch this to our wall bucky. We're going to point it towards our wall. I like to zero it out. It will help you when we do the clavicle. You won't have to do the math yourself if it's zeroed out. All you do is hit this like camera picture right above it and it will zero out. Okay. We're going to bring this into 40. And then just make sure you're detented. And then I just like to start with everything lined up. So top to bottom and then I line it up. So somebody will have to be the patient. Everybody's volunteering today. We're fighting over it. So for the shoulder, you have to find the coracoid process. The easiest place is there's just this little indentation right here in the shoulder. You feel your clavicle come down and there's that little indentation. And you want to be 1 inch below that coracoid process. So, go right in here. Here's her coracoid. So I'm going to center 1 inch below that. So I'm going to move my baby down. And if you can't feel that coracoid, you can also find the AC joint and then go 2 inches below it. And it will come out the same. And then this line, the vertical line, you just want it mid-shoulder. So I'm going to say we're doing the right shoulder, so I'm going to scoot her to the left. You can bring your shield in. Remember, it's okay if it's at 40.5 because that's where it locks in. Then I'm going to show you the collimation. So on here there's 3 gray circles. When you're at 40 inches you want to look at the inner row. And right above the inner row there's some numbers. So this one's going to be top to bottom. So I want to put that one at 10. This one is going to close it inside to side, and I'm going to put that one at 12. So right in here these inner numbers is what you want to look at. So you'll want to make sure you have light past that clavicle. You have light on this side. You have some light above the shoulder. You're going to turn your hand out like this for the external so that those condyles are parallel. Turn your head to the left. You'll bring in your shield, our right marker, and then for the technique, 80 at 10. So that's your external. Any questions on it? Okay, so then for the internal, everything stays the same as the patient wiggled on us here. All you're going to do is turn that thumb in and down so that those epicondyles are perpendicular. Sometimes when they do that, they like to rotate their body, so try and keep the MCP parallel. Right marker still the same, head that way, same technique, still be shielded, don't move, don't breathe, and click. And you can just roll that shield in. So not too bad, right? Because it's just same as the humerus. Once you set everything up on the first one, then it's all set for you to go. in clinic, you're gonna see us, we probably center a little bit lower. We just make sure we have light above that shoulder. And then we make sure we have light on the inside here. Then we just flip that arm that way and then that arm that way and then we're done. So we don't even feel for that coracoid process, just so you don't get confused on that when you go to clinic. So next will be our clavicle, our AP. So you can feel her clavicle across here. You'll want to find the midpoint. So remember, the sternal end sits lower than the acromial end. So you just kind of find the midpoint in there, and that's the height you want to be. So I'm at the level of the clavicle. We're going to be mid-clavicle right there. We're going to keep it the 12, but we're going to collimate down. The lowest it will go here is 8, which can actually go a lot smaller. So you can go to the 8 on the outer row. Because all we need is to make sure we have light below this point and above that point. Put your right marker right in there. This one we'll do 76 at 8. Because it's the smaller bone, so we need it just a little bit lighter. Yeah. Their hand is just in a neutral position, still shielded, head to the left. Don't move, don't breathe, and click. So just centered right over that clavicle. Okay, so now for the axial, we're going to put an angle on the tube, which this is the first time we're doing that. So like I said, you can zero it out, and we want cephalic. So we're going to angle the tube up towards the head. So close your eyes. So I'm just going to go like this until I hit 15. When you put an angle on the tube, your SID changes. So you need to move this into 40. And then you've got to remember to line up your bucky. Okay, so what I'm going to do, once you put an angle on the tube, the bucky and the camera no longer follow each other. So you can just move this down to go right over her clavicle. There. And then what you need to do is you've got to pull the bucky out like we have been and line it up to here. So it's going to be off slightly here because your angle doesn't, it's got to get all the way to the IR, right? So it doesn't hit the board and then go perpendicular to the board. And it becomes more dramatic when we put higher angles on our tube. You'll see it more. So just get used to pulling it out, lining it up there. It does open it back up, so drop this down to the 8 on the outside, the 12 on the inner one. Make sure you have light on both sides, and we're mid-clavicle. Make sure your right marker's still in there. We'll use the same technique. She'd still be shielded, and then don't move, don't breathe, and click. Okay, so not a bad one to start out with the angle on. Any questions on clavicle? And most of the time you can visualize the clavicle real nice so you know where